Welcome to Health Authority TV. I'm Devin DeVries, the editor-in-chief of Health Authority Books, and our mission here today at Health Authority TV is to bring together a community of health business experts, find out what's currently happening in their area, and also look to future possibilities. Our guest today is John Lynn. He's the founder of Swaay.Health and Healthcare IT Today. Welcome, John. Thank you for joining us.
Thanks for having me, Devin. I'm excited to be here.
Wonderful. Well, we would love to know, who do you serve as a health authority?
Yeah, so the overarching organization I work for is called Healthcare Scene, and as you mentioned, we have two main communities within that. We have the Swaay.Health community and Healthcare IT Today. So on the Swaay.Health side, we're focused completely on healthcare marketing and the challenges that healthcare marketing people face. So we started off with a lot of healthcare B2B marketers, people at health IT companies, largely consulting companies who wanted to market to doctors, hospitals, hospital executives, ambulatory practices, people like that. And so we want to serve them and help them be more successful and be able to give them the content they need, the events they need, the learning they need, and the peer connection that matters most for, any professional. You want to connect with your peers so you can accelerate what you're doing and learn from each other. So on the Swaay.Health side, we started in the B2B side of things, but then we also expanded into the hospital and health systems. So whether it's the marketing person, the communication leads at provider organizations, medical practices, hospitals, health systems. We want to provide them the great content and connections to each other. It's a lonely job being a marketer, and we want to help bring them together to understand this is really hard work that they're doing, but there are people that are doing it too and can help each other. And then on the Healthcare IT Today side, we've been publishing amazing content for about 18 years. We're up to 18,000 articles that we've published over that time. I think we're up to 1,000 podcasts, all video and audio. So our goal there is to make the life of the CIO and everyone that reports to the CIO easier. So, we understand the depths of technology in healthcare and how technology can actually impact healthcare for good or bad, depending on how it's implemented and how it's used.
Nice. Yeah, we really love that community idea and that, we're stronger together. So I love to hear that. So what services then do you provide these groups?
Yeah. So we have a wide range of services, and they're kind of similar between Swaay.Health and Healthcare IT Today. Each of them has an email newsletter that we publish. On the Healthcare IT Today side, we publish it daily. On the Swaay.Health side, we have a weekly newsletter that we send out to people. And then within that, we publish, anywhere from 3 to 18 articles a week, depending on the site. So we publish a ton of content, including videos, podcasts. If you search for Healthcare IT Today or Swaay.Health on your favorite podcasting application, you'll find, I think we're up to 4 podcasts that each have a minor different focus. One's focus on the CIO, one's focus on healthcare marketing, and various versions of that. So if you search for those, you can definitely check those out and learn from some of the best experts in the world. And we have a very conversational style that's like, hey, this is what you would talk about if you were at the bar at a conference, in hearing the real realities that these organizations face. And I think people really, it resonates with them to hear real talk rather than marketing talk, which is ironic since we have a marketing community. But so those are some of that's the biggest service we provide is providing content and community for them to be able to connect with each other and learn from each other. And then, on the sponsor side, we certainly offer a number of sponsored content options, advertising sponsorship options for health IT companies who want to be able to market their services to provider organizations. Or on the Swaay.Health side, a lot of our sponsors are agencies or marketing tech services that are looking to get their solution or services out to the marketing professionals. We help them share their perspectives and insights, and we take a real, thought leadership approach to that. which is no one wants to be sold to. But if you show you know the problem domain better than someone else, that's the best way to share your product. So even all of our sponsored content is very thought leadership focused to be able to provide value to those that are watching and listening, not trying to sell to them, because it turns out we've learned over the years that trying to sell something is the worst way to sell it.
Absolutely. Yeah. Well, and then I know you bring them together in person to network as well. So you have an event, the Swaay.Health Live, coming up. You want to share a little bit more about that?
Yeah, absolutely. So Swaay.Health Live, I think it's our 12th year, 12 years since we started the conference, and we bring together just the best healthcare marketing leaders out there. We have an amazing location in San Diego, happening April 15th to 17th in 2025. So, it's an annual conference that we do, and all of those people come together, and we have amazing content. We have great interactions, great food. We're on Coronado Island right there in San Diego. So every room has a view of the water. So you're going to have an amazing experience as well. The best compliment someone gave me is they're like, "Hey, John, I knew you were organizing it. And if you're organizing it, I knew we'd have fun, we'd learn, and we'd connect with a lot of great people." And that's kind of become the formula for us, is that, hey, we want you to connect with amazing people so you can learn from each other. And many have become friends well outside of the conference and be able to support each other throughout the year. We're going to learn from all the content that's there and from, talking with other people. And then we're also going to have a lot of fun. We always throw a good party. We've done karaoke, all sorts of things. So, it's an amazing event that just brings together these people that ironically had never come together before, especially on the health IT side, the B2B side of things. They'd stood across, from each other at a conference, for days at a time, but they never talked to each other. So this is a place for them to come and meet their peers. And sometimes you commiserate over the challenge that it is marketing to healthcare. Sometimes you share best practices, but everyone has a good time and gets a lot of value.
Nice. And, being from San Diego, I'm biased, but yeah, that is a wonderful location. If are not from this area, Coronado is beautiful.
Yeah, our community's been begging to go to San Diego. We finally delivered.
Nice. Nice. Well, we'll make sure we put links in the show notes for people that want to check that out and see if they might want to attend. So now we'll move on to this broader conversation we're tapping into our health authority experts about. And we would like to know, kind of based on your experience, how do you think we can redesign America's healthcare system?
Yeah, it turns out it's challenging because the healthcare system is gotten big and unwieldy, right? It's there's a lot of people profiting off the dysfunction of the healthcare system, and that becomes a big problem. But I'll say that, there's one overarching message that I would say that we need to focus on if we want to redesign America's healthcare system. And for that, I think we need to listen to the patient. We need to put the patient at the center of the healthcare system. And right now it's not. The doctor's at the center, the business is at the center of the healthcare system in many cases, and the patient isn't. And so I think we need to readjust our focus. And it turns out this is a really important thing. And it turns out it applies on both the health IT side and the healthcare marketing side. And that's because if we put the patient at the center, it changes how we approach everything. And we're going to have to do it because patients are becoming more savvy. Technology is giving them the information that they never had before. And it's easily at their fingertips, whether it's the latest ChatGPT LLM that's allowing them to understand complex medical information that they never understood before. We saw this initially with Google. Now we're seeing it with LLMs, where patients have a lot more information available to them to know what kind of care do they want. And so patients need to be participants in their care. And then also, technologies allowed them to understand that they have options. So whether that's a telehealth visit, as a rural organization, yeah, they might be able to hop on telehealth, even though there's only one doctor in town. Now they have options available to them. And we see this, a lot of the largest health systems out there, they see themselves as national healthcare providers. They don't see it as local healthcare providers anymore. And so now you're competing with the Mayo Clinics and the Cleveland Clinics and the Intermountain Healthcare, et cetera, right? That are the biggest
Yeah.
names. So if that's the case, you need to focus on providing the best patient care that's very patient focused. So I'd say that's the first thing, is thinking about how can we focus on the patient. Now on the healthcare marketing side, that's true as well. Does anyone want to call to make an appointment anymore? Like, why have we not embraced online self-scheduling and patient access in a way that, yeah, we've been doing in every other thing we do? I can order groceries to my door with 2 clicks, but if I want a doctor's visit, I have to do a phone call, or I got to fax in a document to give
That
them the
drives me
information.
crazy. That
Yeah,
happy doctor.
it's insane, right? And so that's another part of that patient centricity, and making them the focus of what we do, and making sure they even are aware of what services we have to offer. I say that at the Swaay.Health conference a lot. I get up on stage and I tell them the work you're doing as a healthcare marketer is really important, because you have a solution that can make patients' lives better, that can make doctors' lives better, and we need those solutions implemented so that there's improvement in that healthcare organization, so that patients benefit, so that doctors benefit. So marketing isn't a dirty word. They're not trying to force you to do something that you don't want to do. They're trying to inform you about something that can make your organization better. So it's very different when you look at marketing that way, as an important part of the success of healthcare. Because here's what happens in healthcare, and this is a big problem. The innovation that's happening in healthcare is incredible, but it's not spread equally. So that's part of what we need to do. And that's part of the vision of Sway.Health, is helping people understand what innovations are happening so that we can spread that across the entire country and even outside the country, so that more patients can benefit. So I'd say that's the biggest thing we need to focus on, which is how can we focus on the patient and put them at the center of care. And one last thought, and then I'll wrap up. But if we want to do that effectively, we're going to have to address the reimbursement process. We're going to have to look at the financial side of things, because if we don't, people will just keep profiting off the dysfunction. So, we need a redesign of our and financials and how we pay for healthcare. And I think the person that's going to lead that is the employers, because they're the ones largely paying for it, along with patients who now have a bigger share of the payments for healthcare. So you combine those two: patients that are more proactive because high deductible plans, and employers who are paying way too much for healthcare, we can have a really big impact on what's happening in healthcare.
Yeah. Yeah, those are some interesting ideas. And on the tech side, we're hearing more and more about how AI is starting to infiltrate into this space, and kind of what the benefits and challenges we're going to be seeing over the next few years.
Yeah, if you want to see a microcosm of that, just look at ambient clinical voice. It's a kind of funky term. Now it's becoming AI medical scribe. So
Mm,
it's an AI assistant for the doctor, where they walk into the room, they hit record. Patient, are you okay if I record? Yes, they get acknowledgement, right? There's privacy,
yeah,
and then they just see the patient. The doctor's not touching the laptop, they're not touching the computer. They're not
yeah,
going in there to document while their head's buried into the monitor. They're talking with the patient. And that's transformative, because now they can focus on talking with the patient rather than writing in the paper chart, head down in the in the in the desktop computer or
right.
laptop. Now they're just seeing the patient, and they're able to do what they were supposed to do, which is care for the patient. And the AI scribe's listening the whole time. And then they walk out of the room and the note's completed for them. And now they can actually bill for it, right? I mean, that's why the doctor had to do it. It wasn't because they wanted to. No doctor wanted to do any note, whether it was paper or
Right.
electronic. But AI is allowing them now to satisfy the requirement of documentation for legal, and also the documentation required for reimbursement, but also to bring back the actual care part of healthcare where they actually care for the patient rather than just the documentation.
Yeah. Well, thank you for sharing that example because I think a lot of people's fear is that it takes the human aspect out, but that's a great example of actually allowing the human connection time for that because it's taking care of the paperwork and the details stuff behind the scenes. So that's wonderful to hear. And
Absolutely.
thank you so much for your time and sharing these ideas. And to our audience, we want to hear what you think and really see how we all can start making these changes. So please leave your ideas in the comments. We'd love to get this conversation going. And until next time, may you be healthy, wealthy, and wise.